Gary, welcome, man. We're
Thanks.
so glad you're here. We're grateful that you stopped by, adjusted a little bit of your plans to see us today. Know you're a busy guy, but I was telling you right when we walked in that we could not let you get back to Utah without stopping by the farm. So just thanks for stopping by. Thanks for being here.
Yeah, well, my pleasure. As I was saying, even just coming onto the campus, right? It's amazing. I just have a lot of good memories about coming out here. A lot of good recovery pieces. I mean, the early days, I remember coming out here, and a lot of folks won't remember this, but there was a piece called the Nashville Summit that was back in the days of the early days of medication-assisted therapy, and really one of the things that I always admired about the facility is you brought out, I guess at least the people that we thought were thought leaders at the time.
Yeah.
And it was really this collaboration of, and really a lot of smart people. I remember being very, almost intimidated, right, by the group of people that Cumberland had brought out, and it was a big honor for me to be included in that group. But I just always, you come out. I remember coming out for a couple concerts, and it was I just really liked what you always did.
Yeah.
Right? So.
And shout out to Walt Quinn. He was actually on the podcast a couple weeks ago and talking all about the history and telling some interesting stories of behind the scenes of how all that came to be. So before we get any further, Gary, would you mind introducing yourself?
So my name's Gary Fisher, and I am the Director Emeritus from the Cirque Lodge in Sundance, Utah. So I worked for the lodge for 23 years, and before that I had another 10 years working in behavioral health before I ever went to work at the lodge. But it was an interesting time, right? And I don't know how far afield you want me to go with it, but it was the late 1990s, and managed care had kind of come in and kind of torn the heart out of treatment, right?
Right.
And it wasn't, and I don't put that on the insurance companies. I think, the treatment centers had not been very good stewards, and stewards of the clients or the funds they were being paid. And so as a result, it was the advent of managed care. That was a term that a lot of folks back at that time hadn't heard, right? But basically, and their job was to manage the care, make sure that, that they had some oversight. But ultimately, what ended up happening, at least from our point of view, was that a lot of folks who really needed care weren't getting it. And, you would have somebody doing some case management for a client in Nashville, Tennessee, and the case manager was over in, Irvine, California. And, it was kind of in terms like, well, they don't meet medical necessity, or, they don't meet clinical necessity for this level of care, terms that, today are fairly common. But back in those days were terms that, we had never heard. All we knew is that we were discharging people after very short lengths of stay. So people would be leaving after 6 or 7 days of care, and then ultimately coming back and coming back into treatment many, many times. And so there was this really this perception that treatment didn't work, right? And I would always say that treatment, the way they were designing it, wasn't working. But at any rate, so it's late 1999, and the gentleman by the name of Richard Losey has this idea to do treatment, but not take any third-party pay. We're going to have people pay cash. And so, in other words, you come in and you come to care, and in conjunction with your therapist, decide really on what the length of stay was going to be. And so no pressure from some outside third party. And at the time, today there's probably lots of cash options, but back in those days there were very, very few. And I remember the big fear, right? The big fear was, well, my God, it's going to, narrow the funnel. And really our idea is if we're going to go out of business, let's go out of business on our terms. Let's not go out of business on the terms of a third-party payer that was either going to not pay us or slow pay us and again, I don't want to make this like they were villains or anything like that. It was that they just had a different opinion of what needed to happen than maybe our clinicians were having.
In a lot of ways, I think at the time, our field was, and we still struggle with this, but speaking in a language that a larger, broader science medical communities can't hear in, right? And although managed care in some ways damaged providers in terms of their ability to reflex into those standards, and also, like you said, the biggest one was probably the perception that addiction care doesn't work, or that there's kind of money-hungry players in the field that just want to take people's money and not help them. But in some ways, managed care might have helped the field.
Oh.
Like you said, now today, the language of medical, clinical necessity and presentation are things that are just part of the trade, part of what we do every single day, part of the language that we speak that allows us to maybe better step into those partnerships with payers that allow for people to stay engaged in treatment over longer periods of time. And it makes sense because if you understand our history, recovery, 12-step culture, so too did the field grow in parallel. It's just interesting that you had that, because I don't know if you know this, I wasn't working then. but it's very valuable that we capture and celebrate that history of understanding where we come from so we don't vilify those relationships.
Well, and I think, and I think that happens today, right?
Yeah, how does it happen today?
I think it happens today because, you have a couple of different groups, right? We'll have the abstinence-based treatment guys, and we'll have the harm reduction guys, and somehow it gets into this that that either instead of that our way, you might not want my way, but there's another way. Let me get you into this other.
Right.
This other section. And that was the same thing back in the day. And the truth of the matter is the treatment field, Nick, our vernacular, has been terrible, right? we didn't talk about like disease reoccurrence. We talked about relapse, right?
Right.
And oftentimes these people were relapsing within 30, 60 days. And it really wasn't a different treatment episode, right? It was the same treatment episode. They just weren't in any other, what's the word I'm looking for? Diagnosis. We would have just called it a reoccurrence.
Right.
We wouldn't have called it a relapse. And so in many ways, I think that, we shot ourselves in the foot with some of the vernacular that we stubbornly held on to for a long time. And then, again, we get into that part where you can be in my lane or you can be in that lane, but you can't be in both lanes. And the truth of the matter is that was just false, right? For a long time, Cirque was, and still is to this day, an abstinence-based treatment organization. But that doesn't mean that everybody succeeds with abstinence.
Absolutely.
And I'll say this, with the advent of, back when I was, I'm a guy in recovery, right? And so, and back in the day, as ruthless as we thought alcohol and drugs were, weed, cocaine, heroin, opioids in general, there was no fentanyl no fentanyl in the game, right? And that's such a game changer in my mind, because a lot of times these guys never get back to care, right? Or they're overdosing so quickly, and overdose means dying. And so in many ways, I think that we just have to be benevolent. Again, it's like, we might have different philosophies about how people get better, but the fact of the matter is get better. We can, let's survive here. We can thrive later, right?
Yeah.
And if you're into the thriving part out of the gate, great. let's do that. But
can you speak to, because I want to learn and hear more about your experiences with Cirque start to finish, because we just have so much respect for what you and your team and the folks out there have built, and Brittany, of course, nowadays. But I think it's really interesting to tell the story as two people in recovery about that. In some ways, if I might describe it as self-righteousness, about this way is the right way and this other way is the wrong way. And it's either, if you want to do it the right way, you'll do it this way. And if you want to do it the wrong way, then you'll just have to do that somewhere else. Can you speak to why it is that that phenomenon has occurred in our field?
Well, and again, this is, I think, personal opinion, right?
Please.
So take it for what it's worth. But I think for a long time, the thought was it would be very difficult to combine these two milieus, right? So the milieu were people were just, it was abstinence-based, and then all of a sudden they're looking over here at this group doing this opioid replacement therapy, and it's like, hey, I want some of that. And the truth of the matter is I don't believe that was ever true, right? But that was... that's what we believed, right?
Fear,
at the time.
Yeah.
It was this fear that, that we were going to contaminate both groups. And, it was funny because I just came back from a piece. We got the opportunity to participate over at Onsite and went through this men's retreat. And one of the things but the best part of some of those retreats is those conversations that you have after the sessions are over, and we were sitting and we were talking, and I think initially everybody believed that the thought would be that the folks who were attempting to do the abstinence trail would get pulled over to the folks who were doing the replacement therapies, right? But the truth of the matter is that the people who are doing the replacement therapy, the medication-assisted treatment, my belief is they're actually attracted to the abstinence-based guys, right? So I think if we combine these groups, that they'll actually, we just give somebody a chance to get their feet on the ground. And for most of the people who've known me my whole life, that has not always been my philosophy, right? And so, but, and again, it was, like I said, in defense of that group, it was, the drugs are more deadly, and they are, right?
Especially today.
Today. I mean, it's, call it an epidemic is to undersell it. Right?
Absolutely.
And so.
It reminds me of, because I still consider myself a young man, although Steve calls me old these days. But what I'd say is, because I'm in recovery too, and I remember, Gary, when I had a year clean and how excited I was for recovery. And when I say that, an example would be like, I'd be on a Southwest flight, who knows where, maybe visiting family or something. And I would always find a way in a conversation with somebody sitting next to me to talk about my participation in 12-step culture, and maybe even bust out some literature and be like, have you seen a step working guide before? And somebody's just like, whoa, man, like we just went off the rails, right? But I think that what it speaks to in people in recovery when we talk about kind of the infusion of evidence-based therapies into our field and how that challenges our preconceived notions about what's good and what's not good for patients or clients is that a lot of us that work in this practice or this field are in recovery themselves. And it can be really challenging if you don't watch out, if you don't have guys like you who have more experience to say, it doesn't have to be an and, it can be an or. And it doesn't have to challenge our own kind of ways of being with our own recovery journeys. So I think that's what the fear was. I was at Cumberland Heights just 6 short years ago when we were in the process of really adopting MAT system-wide. And really what I mean by that is we were using naltrexone for a long time, and we were using buprenorphine for a long time, Chappie Sledge, of course, for detox only. But we hadn't made that transition into using buprenorphine extended tapers throughout the course of treatment and potentially post-discharge. And gosh, I remember many meetings with our staff worried that people were going to quit, worried and fearful how the community was going to react. And when we went ahead and made the decision that we were going to move forward and just do this, we made it an issue. It was a non-issue to our community. And in some ways, our community was like, I think that's a good thing. You're helping people reduce the risk of overdose. And in a lot of ways these days, death, and giving them that chance to maybe buy into the principles of recovery. It might not look like the recovery that you and I traditionally participate in, but hey, man, if they're plugged into a community and a spiritual practice, it's going to be okay.
Because that's what recovery is, right? Recovery is that connection with others. If we can just get them into community, we'll get it. Then they can self-select, right?
Yeah.
I mean, it's never our job to decide what recovery should look like for each other. It's like, look, this is what it looks like for me.
Yeah.
And something, and I'm a big proponent of it. And it was. I was a young man who, I couldn't go 30 minutes without having a cocktail or smoking a joint or doing some cocaine. And so, I I actually had the opportunity to be incarcerated, right? But I oftentimes said that the greatest incarceration I ever experienced was this incarceration that I was in under the influence of drugs. And so, and like you said about being on the plane, that's awesome because, man, you're like this man with with a new life, right? And you want to share.
Of course.
Right? I want to share with you, right?
Yeah.
And so, but oftentimes it's kind of like what, I oftentimes used to say, there's lots of roads to Rome, and this road, this might be the road that Cirque Lodge is on, and this might be the road that Cumberland's on. And, one of the things that I'll share with you is that, I think about the courage, right, that it was for some of the long-time treatment groups, the, really the anchor groups of recovery, to start to make those changes, right, and to kind of get a different perspective and say, look, let's look at doing this different, and and that's the, and there's lots of things that, over a period of time, I remember. I mean, this will probably scare the hell out of your listening audience, but when I came in or when I was getting sober, they were doing aversion therapy where they'd actually make people ill, right? And that was, if we do this long enough, these people will, be repulsed by the eye. I mean, and at some point somebody thought that was a good idea, right? That was a good, and they were well-meaning. They were, they had the science of the day, right? And so that was, and I think out of that, it's, some different, and always we were trying to kind of raise the bottom. I mean, really, that's what treatment does, right? We, fortunately, my bottom was jails but really my bottom was that I didn't speak to anybody in my family, right? My bottom was that I had a really very short-lived marriage. I mean, months and days, not, those were, and so, the idea of coming into treatment is, hey, you don't have to suffer that, right? We can raise this bottom. And, and again, the problem or the scary part today for even a guy who's, been 37 years now in the treatment industry, and I'm retired now, but let's say it was those 35, it's much more deadly today, right? I mean, the friends that I went to college with, they weren't, nobody was dying the next day, right? That's not what you walked into. And so yeah, I think it's incumbent upon the thought leaders in the industry today to, to start to change the vernacular and start to be more inclusive, with the different treatment entities.
I really find it very helpful to, whether it's you or, Steve or Jay, he'll kill me for lumping him in that, but, to lean on our history in a way that makes us understand. You said the science of the day.
Yeah.
It's important because oftentimes, we're all the protagonists in our own story, right? And we always think that we're on the cutting edge,
right?
Whatever day is the present.
Right.
And like you said, aversion therapies, that day, I was a cutting edge.
Yeah.
The integration of SSRIs at that time and the similar journey that it had to MAT into our field, that was the science of the day. MAT 20 years ago, 10 years ago for some providers, 6 years ago, the science of the day. And what is it today? And we need to always, what I like to say about Cumberland, and I mean this with all respect, and providers like us, like Cirque or, maybe Fellowship Hall, North Carolina, whoever it is we try our best to be meat and three. Everybody loves meat and three, and you know what you can expect, right? And there's something to be said about a provider that can be around for a long time and remain consistent. There's maybe even something spiritual in some ways about it of not having to. We want to invest. We want to do our due diligence with therapies. We want to try new things out to raise folks' bottom. That's the name of the game, right? That's our mission. But we want to be careful and we want to be cautious that everything that we do is in lockstep with making sure that we're supporting folks that are being affected by addiction. So today, like you're mentioning with fentanyl, just to be clear, right? Just to be very clear, it's a good idea for us to start considering and implementing harm reduction modalities that help give people a chance to stay alive long enough to experience some version of recovery. I've told a story before, I won't tell it again, but Michael Botticelli, a former drug czar, he did a talk when I was in graduate school, and this is another example that you'll love, but basically at the end of his presentation, I was like first year graduate student, and I was the first person to ask a question. And I kind of got into his face, from the crowd, and was like, how do you think this is going to impact, the recovery culture of these folks? And, he very politely and very accessibly, responded. And then afterwards came and found me. Oh, wow. Which says something about him. Mm-hmm. And we ended up having a really nice conversation. He killed me with kindness is what he did, and just said, he's like, Nick, we're just, the policy of the government right now is, in the Office of National Drug Control Policy, is just try to keep people alive long enough to experience what you've experienced. And I was like, dang.
Yeah, and one of the things about it is like, whether it's Cumberland or whether certainly at Cirque, the social economic demographic that we get to work with or that I got to work with back at that time, there were many, many resources, right?
Yep.
That was, and I really oftentimes think that the real saints of the industry were the guys who were working with the indigent and low-income populations.
No resources.
Resources. And so, hey, man, we just need to get somebody to tomorrow.
Yep.
And, and the thing about it is that, and maybe because of that, right, we've been slow to assimilate some of these new ideas. And I do think there is some prudence. And, there's been so many different treatment ideas, right? Mm-hmm. Medication ideas about, the latest silver bullet, right, that was going to cure this or cure that. And we're not that. They weren't. They weren't a panacea. In fact, if anything, it kind of, in some ways, opened Pandora's box. So there is a part about being prudent about how we, we make these steps. But I do think that, as you go along, I remember, I'll share this story with you. I was sitting with a gentleman who was the medical director of a fairly prominent treatment group here in the country, and they too were moving to some medication-assisted therapies, opioid replacement therapy, whatever anybody wants to call it. And I remember having a conversation and again, kind of, like Michael Botticelli, just kind of killing me with kindness. And I said, it's not so much that when you guys do this, that you won't do it well, because I believe that, right? But then it's just going to open, kind of for every facility who might not do it that well in the country to kind of adopt this, this policy. And I'll never forget, he said to me, Gary, he said, unlike you, he said, I'll be sitting across from a young man and I realize that I can make sure he doesn't die tomorrow by just writing this prescription. And he said, he said, and I get it. You don't have that capability. But he said, I don't know that I could live with myself by not taking this opportunity to make sure that this young man or this young woman isn't with us tomorrow. And, I had at this time, it was just like kind of something in my heart opened up. And I said, I so get you. And I understand that. And I think if I was sitting in that chair, that would be the decision I was making.
Yeah.
Now, it's not that we changed our policy at that point to go along with that, but it gave me great empathy, I guess, for the dilemmas that we face. And I think it was enlightening for me to kind of start to understand why people were moving in that direction. And then, fentanyl's just kind of, made that.
Yeah. One of the last things I'll say, and then I want to ask you about Cirque and your experience, is just God's got us. God's got this field. I like to say this a lot, but, we're all temporary proprietors. So I today at Cumberland, I'm not going to be here forever. Jay's not going to be here forever. Our nurses, our admission staff, our counselors, and I think it's just our job to make sure that we do the best job we can. So take me back to the beginning of your time with Cirque. I want to hear all about that and what got you down that road. So I think that's really interesting.
Well, it's kind of an interesting piece. I had. I was working with a friend at that time, and we were taking nonprofits, maybe a little less sophisticated nonprofit than a place like Cumberland, but there were a lot of mom and pop nonprofits in the chemical dependency arena that all depended on state and county funding for to be able to provide treatment, and that worked great when the state and county coffers were full, right? But all of a sudden, the budgets, the states had a hard time, and then all of a sudden, nobody was getting treated. And so this friend and I, we had the opportunity, and we had a lot of experience in managed care contracting. I had worked for the Sisters of the Holy Cross at one point, and I had worked for Charter at one point, and so had gotten a fairly good education about doing managed care contracting. And so we were taking these nonprofits and getting them impaneled with third-party payers. And so what that did was give them a different revenue stream. And so even, it just made it more viable. And it was pretty lucrative, right? I mean, we got paid pretty well to do it. And the truth of the matter is my friend got his PhD, and he had always wanted to kind of open his own shop. So he did. And at that point, I was kind of out there on my own. And about that time, I received a phone call from a friend of mine wanting to know if I was interested in coming back and working in residential care. And the place ultimately ended up was going to be Cirque Lodge. And I said, I'm not really interested in that because, as I had mentioned earlier, it was kind of a tough time in treatment, right? The managed care folks had come in, and it had gotten pretty skinny. There was no...
It's a good word.
Yeah, skinny.
Yeah.
And so at any rate, I remember I went up to, they were having a lecture, and they had an interventionist in town by the name of Ed Storty who came in, and he was doing this lecture, and they invited me to come up and and to listen to Ed. And I knew who Ed was, right? And I was interested, and I was really interested in going up and seeing the facility. And to tell you how different it was, Nick, we had, back then we talk about the science of the day, right? And the science of the day at that time, the treatment centers were really not very nice, right? I mean, it was either the bottom unit in some hospital or the psych floor with the ugly green tile. And I mean, you felt like a criminal being in chemical dependency care. And I remember going up it was this mountain lodge, right? And you'd heard about places like this place in Malibu or Sierra Tucson that were, but I mean, I remember going up and almost literally when I tell you this, I could just almost got the goosebumps, right? And I went, wow. And Ed got up and talked about a change, right? Talk about a paradigm shift. And he was talking, and at this point, I had been involved in a few interventions just because I had been in behavioral health, right? And he was talking about his kind of motivational style of intervention versus confrontational style. And he talked about doing these letters, but instead of letters like you can't, if you don't stop, you can't see the kids, or you can't come home, or things like that. And he talked about, hey, we're gonna talk about love, right? We're gonna talk about, hey, we want you back. We want you back in this. And he ended up telling this story. It was such a great story. That this gentleman had walked in and everybody was seated in the chairs, and he knew exactly what was happening. And so he said, "Oh, I don't oversell. I'm ready to go. I'll go right now." And it was what Ed said then. He said, he said, "Sit down." He said, because he said, it's not every day that people are going to tell you how much they love you when you're alive. Mm-hmm. And he called it the living eulogy. And man, it was like, hey, this was the new math, right? I had never heard this in my, it was like, wow, this is like, I wanted to know this guy, right?
Yeah,
and
of course.
Because, sometimes back in those days, I would think that the intervention was almost as traumatic and anger producing as the alcoholism and drug addiction had been, right?
Very confrontational. Yeah.
And so so here I am, I'm in this, And this was the facility my friend had talked to me about, and we ended up having a couple of conversations. And the truth of the matter is they started this treatment center in Sundance, Utah, and the truth was nobody came, right? Because for therapists, it's kind of like, it was new to them, right? All of a sudden, I remember I had this one therapist who said, don't you think that's mollycoddling? I remember the word mollycoddling. I don't think I'd ever heard that, right?
I haven't, yeah.
And I said, well, why is it that when people go to the hospitals of the day, to tell you how far back this was, Nick, they still had wallpaper, right? People were using wallpaper, and there were armoires, and I remember this nurse saying to me at one point, I said, wow, this is a nice hospital room. And she said, well, yeah, it's better for the patient. Huh. Never forget that. And I said, why wouldn't we do that for the chemical dependency client?
Right.
Why don't, let's we punish ourselves enough, right? I mean, I talk about being your own worst self-critic. So they didn't need to see that sitting on the bottom floor of the psych unit at the University of Utah hospital, right? It was like, look, let's put these people in let's kind of start to take this shame away. That was the new science of. I mean, it sounds like, come on, you can't even believe that was happening, but that was the truth. So at any rate, I ended up coming, and they were very malleable, and the owner was a gentleman who, he had resources, right? And I remember him saying, I remember saying to him, Nick, and this I think was the part that totally sold me. Is I said, what's in this for you? And he said, and he laughed, kind of chuckled, and he said, well, I don't need a check, but I'd like to quit writing so many. And but what he told me that was really poignant was he said, he said I'm a good businessman, but I don't think he thought that he'd ever done anything great. And he really believed this was going to be great. And he said, I believe it'll be great whether you come with me or not. And that was attractive, right? We talk about attraction rather than promotion, right? And I will say this, so it wasn't this part where we were worried about full-time employees or, some sort of expense. Franklin had this line. He said, the definition of character is the ability to carry out your decision after the emotion of the moment has passed. I always loved that. But I oftentimes used to say, it's easier to have good character when your owner has deep pockets. And so, I was never put in that decision about having to keep somebody that was going to be disruptive to the milieu. I was never put in the position of having to discharge somebody because they didn't have the funds to stay in care. And that was all Richard Losey, right? I mean, he gave me that autonomy. I oftentimes say I cost that man millions of dollars, right?
Yeah.
But the point is that, and when you can do what you say you're going to do for an extended period of time, that develops trust, right? And so, I really think that, hey, look, it's we were able to hire, a talented team, but there's lots of talented teams, right? There are. I mean, there's talented teams at Cumberland, at Cairn, at Hazelden, at, Fellowship Hall. But, I think one of the parts is we were able to kind of keep this trust with the public. And, I believe they still do, right? And I think one of the greatest pieces for me was, after I left, they actually are better, right? Sometimes, I'll tell you guys a story. I'm sorry, the podcast people are probably like, oh my God.
No, this is great.
I was a big George Washington fan, right?
Yeah.
So, and oftentimes, what many people don't know is that they'll say that George Washington's greatest contribution to our country wasn't the fact that he led the Continental Army or anything like that, but that he retired. He retired. And he knew when to get out of the way. But the reason that it's easy to get out of the way is if you have this group coming up behind you, right? And that was one of the things I think, you mentioned Brittany Harris, right? And I mean, just an incredibly talented young woman with a ton of energy and new visions. And so the fact of the matter is, the gentleman who was the experiential therapist with me, maybe one of the most talented guys in the country. And, as he retires, there's these, this younger echelon of experiential guys right behind him. And I was down there the other day, and I mean, these people are, it's brilliant, right? Just going out to onsite, right? Seeing this vision that Miles Adcox has. I mean, it's tremendous. And his staff coming here seeing you.
Yeah.
Right? I mean, hanging out with you guys. We got the opportunity to talk a little bit earlier about, going up to a conference at Bill Wilson's house. But the thing about it is it really wasn't for me, it wasn't, the material or the curriculum or anything like that. It was looking around and go, oh, we're good, right? I mean, it's in good hands, right? And the truth of the matter is, look, I'm not being self-depreciating. I was a pretty smart guy. But the group today is smarter. The group today is, they have more knowledge, as they should, right? And it's incumbent for us to put those people in charge and to get the new ideas, right? And not that we don't listen to our elders and learn from our history about why we did things and didn't do things. But, like George Washington, it's just, you just need to know when to get out of the way, right? Better to go a year too early than a day too late, I promise.
Well, I do want to, I agree with everything you said, and there's so much wisdom in all that. But Gary, you also had a tremendous impact, and I know Brittany would say the same thing if she was here. She'd want me to say the same thing. And I love her, and I've gotten the chance to get to know her more as a person. Not the credentials that we all walk around with, or but as a person, she's a wonderful person. But that speaks to you. In a lot of ways, in the leadership that you had. I was going to ask you a leadership question, but I'm going to say something else that I was going to save to the end, because Who cares? When I got into recovery, my sponsor at the time, Lewis L. from Lubbock, Texas, always taught me that you did three things when you were introducing somebody or giving somebody a chip or introducing them to speak. You described how they had been of service to other people. You say something about them that they wouldn't ordinarily say about themselves, and then you talk about how they touched your heart. So one thing about you, Gary, I'm just going to put you on blast. But one thing about you that I've always noticed over my short period of time, in this field, in this community, is I see you being of service to everyone around you in ways that everybody I talk to, when I mentioned Gary Fisher, like when I texted Jay just to remind him this morning that Gary was going to be here, like I don't get a lot of colorful messages from Jay, I'm giving him a hard time, but he was so disappointed that he wasn't going to get to be here because he loves you, because your posture, your way of being when you're with people is that they're the most important person here. And I think that speaks to your character. Something that I think you wouldn't say about yourself is that you have this humble leadership about you that I think is special and unique. A couple years ago, we were at a conference, I don't remember where, Gary, it was at NAATP, and you gave Ruth Ann Rigby an award. And one thing I learned about you is it wasn't about you, and you didn't make it about you, but you presented this award, and there wasn't a dry eye because it was so important to you that you honored her and her service. And we love her. She's amazing, right? Because she is, but it really affected me in a way, just to see the type of leader that you were, because to be honest, Gary, like for those that are listening, you're one of the more successful people in our field. You had a tremendous impact on hundreds, if not thousands of people's lives in and out of the rooms. And the last thing is how you've touched my heart in particular. And it was when we were in Vermont. And myself and Nico Dorn were there confused. Why are we here? Like there must have been a mistake on the invitation list, because here we are, two young guys that, just like everybody else, feel, incredibly unique. And you and Bobby Ferguson and a few others took time out of it to put your arms around us young guys and just say that we matter, If you want to make an alcoholic cry, just tell them how important they are, right? And you did that for us. And I just want to thank you from the middle of my heart for your service and leadership to our field.
Well, that's, incredibly kind, and you're right. It's flattering. And I'm grateful. It's one of the things, again, I'm just coming from on-site, and so one of the things that they were talking about was a little bit about your legacy, and I hope that, I hope my legacy wasn't what I've done, but more along the lines about how I did it. Yeah. And, hey, look, I do remember the part with Ruth Ann, and that was, and here's this woman, right, who's just done a ton of service.
A ton.
And and there's the service that we see, but the greater, it's like the iceberg, right? The greater portion of this service for this woman is stuff that almost nobody in the public ever gets to see, right? And, and I think, one of the reasons it was so emotional that night was just really how overdue her, this accolade was for a person like Ruth Ann. And, and I remember being that young guy in the field, right? And you're the young guy in the field, and you show up, and everybody's sitting at the table, and you don't really have a seat, right? It's kind of like, and just one more time, I'm the odd man out, right? And how important it was to me when somebody said, "Hey, Gary, do you want to come? Do you want to sit with us?" Right? And because that's who we grow up being. We just want to be a part of, right? And so for somebody to say, and I never forgot that, right? That how somebody remembering my name coming up and saying, "Hey, Gary, do you remember me?" And of course, I remembered them, right? But and it was just, I just remember. I think one of the best parts about the field of behavioral health and residential care is just that we all tended to look out for each other, right? And it was almost, and again, maybe one of the beauties of the 12-step community, right? Come all the way in, sit all the way down, right? You're part of us, right? And you might not feel part of us right now, but you're a part of us. And, and I think one of the things that I tried to do was transcend that to, the field and hey, look, kindness goes a long way, right? And boy, I was a guy who had not been, I couldn't afford myself kindness. So when you afforded me kindness, I think I was more appreciative.
Yeah. Well, I think if the measure is making sure that everybody feels like they have a seat at the table, you have checked those boxes, Gary, in spades. So, and I hope, to be frank, and who knows how people will perceive this conversation, but I hope that we carry your legacy. We carry the legacy of making sure that those folks that are new here, maybe it's a new employee, a new team member, or a new patient, or whoever we cross paths with, a new partner in the community, that there's more than enough room at the table. There's more than enough. Something I think about often, just being in Tennessee, and this idea of competitors and all, and it's like, what are you talking about? There's more than enough really hurting people, that might not get a chance to discover something about this way of life. And it's our responsibility, I think, as temporary proprietors to make sure that they feel welcome. And you segued brilliantly. I was going to ask you what you have loved the most about this work over your career, and I'd be curious how you would answer that question.
Oh, well, it's easy, right? It's the people.
Yeah.
It's the relationships. I think one of the great things about, and I'm so in agreement. I think if there was one thing that I understood early on, is he was my colleague. He wasn't my competitor. And, the part that just, again, we talked about being out at onsite, right? And, and here, I get the opportunity to do this podcast, but there were a dozen guys there that have been showing up to onsite literally, I think, for 18 or 19 years, right? And it's one thing to go the first time and do that work, but then to kind of continue to show up so that we could be better men in our marriages, we could be better employees, we could be better employers, right? That we could be better friends, right? And to do this, to do this work. And, hey, look, I grew up in a loving family, right? But sitting in those rooms with those men, it's like, man, this is love, right?
Yeah.
The new math. And, you talk about having a seat at the table. And I think kind of an interesting piece is last night was the kind of the final supper that they were having for everybody. And they had this really long, lengthy table. And I happened to be sitting just at one end of it. And everybody was talking about their moment of gratitude, right, in this 2 or 3 day period. And I said, I just told everybody, I said, I just wish you could have this view that I have here of this table, right? And the toast last night was to longer tables. So not only does everybody have a seat, but we can lengthen this table out so that we can, that more people can participate. And, one of the things for the listeners that I think is, there's so many talented therapists and this was a men's retreat. I think they do the women's retreat in April. So, but, just to longer tables, right? Let's get everybody at the table.
Absolutely.
We'll do better.
So as we wrap up, I have one final question, and this might be the most important question. because I told you before, there's all sorts of folks that are listening to this show. There are, hopefully our friends, our colleagues, some of our team members, but I hope more than any of those, I love all of them, shout out to y'all, but I hope if there's anybody else, it's the families that are lost at sea, grasping for any kind of resource. It might be an individual themselves who is using against their will today, like we talked about earlier. And I wonder what you would say to them, what you would say to the mom or the dad or the brother or to the individual themselves that just can't stop using today.
Well, I think, first, one of the things that, talk about shout outs, right? And I think a shout out to really some of the staff members at Cirque Lodge that were so influential in my life. And I remember our clinical director, a woman by the name of Beverly Resch, who's, again, another incredibly talented individual. And she would always, at the start of our family week, she would get up and she'd say, your loved one might not get better, but you can. And, and I think that, one of the things about it is that we all go into care hoping that this other person is, that they can fix them, right? This is from the family standpoint. But the truth of the matter, and just like going to onsite and having the therapist do their own work, is that, for the families to come in and do their own work and again, whether our loved ones get better or whether they don't, that we get better. And in getting better, we change that dynamic, right? We make it a more amenable situation for maybe the addict alcoholic to come back to. And for the addict alcoholic out there who's still suffering, the thing that, the good news, right? The good news is that people get better every day. And there was a part where, and I remember this, I remember walking into a treatment program, Nick, and I said to the gentleman, I said, we're going to talk about this, and I'm never going to drink or use again. I said that I just don't think you understand my problem. And I'll never forget, very calmly, he looked at me and he said, well, he said, that doesn't describe the dynamic, but pretty much. And what I will tell you is, for a gentleman, I oftentimes used to say that they should have put my face on a poster that said, basically, if this guy can do it, you can too. And I think that's the thing, is that we don't hear the good news, right? We always hear the bad news because that's what sells, right? I mean, that's what gets on the 5 o'clock news or the 10 o'clock news, is the overdoses and the, just the robberies and the things that, because that's some sort of titillating piece that draws people in. But hey, the news, and I got to see it through, like I said, 23 years at Cirque and 37 years of being in the behavioral health field. Yeah. I got to see people get better every day. I got to see families restored, right? Yeah. I got to see miracles. I got to see miracles here at Cumberland Heights, right? I just coming out and so don't miss the miracle, right? I had a really good friend of mine in treatment, and I said to him at one point, I said, he had certainly, had a legacy and was this guy. I was like, what are you still doing, right? I mean, it's like, and he looked at me and he said, he says, I'm addicted to the miracle. Never forget.
100%. Thank you, Gary, so much for being here. We'll let you catch your flight. We love you. We're gonna. We hope to see you again out here soon, and we hope you give Brittany a little bit of a hard time for not being here yet. We love her, and we need to get her out here. So, thanks again, man.
Okay, thanks, Nick, and thanks to Cumberland.